Hello students, so this is Dr. Shubhanshi, Senior Lecturer in Department of Prosthodontics, Crown and Bridge in the College of Dental Sciences, BBD University. So this lecture is continuation of Provisional Restoration in FPD. In previous class, we have already covered about the techniques that were used in making temporary crowns, that were direct technique, indirect technique, or direct indirect technique. We have also studied about the replacement of single crown. So you can go in the previous video and you can learn about the techniques of fabricating the temporary crowns. Now in this lecture, we are going to study about the provisional crown for an endodontically treated tooth. So if there is a post and core, and post in case of post and core, we give how we give your temporary crowns. It is often difficult to fabricate provisional restoration for a tooth that has been prepared for a dowel core because there is so little intact supragingival tooth structure. This can be accommodated for in the use of standard polycarbonate crown by placing a piece of paper clip or other stiff wire into the canal and place resin filled crown with dowel over that. So according to the article, it was shown a provisional restoration technique for laminate veneer preparation. A direct construction technique for provisional restoration uses auto-curing acrylic resin and other available armamentarium to facilitate the construction. Only a slight preparation modification of tooth is to be treated is necessary to retain the provisional prosthesis. This is an article in Prosthodontic Dentistry in 1989. It shows the veneer preparation. In this picture shows the veneer preparation. Now the diagnostic wax up has been done. When the diagnostic wax up is done, putty index is made. Putty index is made with that diagnostic wax up. Now bis acrylic temporary material was dispensed into the putty matrix to fill the facial surface. The filled matrix was inserted into the patient mouth. The provisional veneer was removed from the patient mouth. Once the material is been inserted, now place that index into the patient mouth. After the material has been set, remove the putty indices. Removal of matrix for trimming of excess material has been done. Now the trimming is been done. We can cement with the cement and clean up the excess cement, as we can see in the picture. Now, again, classification based on the duration of use. We have already studied about the two classification. One was according to the types of crown, which were metal crowns, plastic crowns, and cellulite crowns. Then again, we have used the fabrication technique, that was direct technique, indirect technique, direct technique. Now, the third classification is based on duration of use. Based on duration for which the restoration is intended to be used, provisional restoration can be classified into short-term temporary crowns and the long-term temporary crowns. For the short-term, it can be used up to 2 weeks, and long-term, it used for the 2 weeks to a few months. Basically, long-term temporary crowns are used in case of full mouth fabrication or where patient need more time for the for definitive prosthesis. Short-term temporary restoration. These are used when the prosthesis is to be used for maximum of 2 weeks. They are indicated after tooth preparation in fixed partial denture. They are either custom-made resin or available as preformed crown. Polycarbonate or aluminum crowns are most commonly used for the short-term restoration. Long-term temporary restoration. They are usually made of cast metal. Though their strength is more than average, they have a history of frequent breakage. Indication in the long span posterior fixed partial denture, prolonged treatment time if patient is unable to avoid excessive force on the prosthesis. Now the last classification is based on the material used in the fabrication of provisional crowns. There are several materials which can be used. First one is acrylic. Acrylics are being used since 1930s. The most commonly used material today for both single unit and multiple unit restoration. They produce acceptable short-term provisional but tend to discolor over time. Advantages are it is low cost, it is acceptable aesthetic and versatility. And disadvantage is objectionable odor, significant shrinkage, and heat generation during setting. Next material is polymethyl methacrylate. Polymethyl methacrylates are commercially available as Jack Alike of GC America, temporary bridges resin of Densply, Neopar of SDR or CAR, and Durale of Reliance. Advantages of polymethyl methacrylate are it is low cost, good wear resistance, good aesthetics, high polishability, and good color stability. While disadvantages of polymethyl methacrylate are it wraps because of polymerization shrinkage, heat production during polymerization due to exothermic reaction, which can also damage the pulp. The free monomer that is present may cause pulpal or gingival damage. Now, next material is methacrylates. These are the brand name. So the advantage of this material is it is low cost, less heat, and less shrinkage. But the disadvantage is it is less aesthetic, poor wear strength, eugenol deteriorates the resin, and poor color stability. Next material is epimines. Epimines were first of two paste acrylics commercially introduced in 1968. Although Scruton had relatively low shrinkage, heat production, and lowest pulpar irritability, it was weak and could not be altered or repaired. Next material is composite. Composites are autopolymerized, dual polymerized, and visible light polymerized. Shrink less. These composite always shrink less. They give off less heat during the setting. They have shows the excellent aesthetic properties, minimal odor, and can be polished at the chair side. So among all the material, composites are one of the good material which we can use. Now there are recent advancement in the composite. They are Protem 2, Protem Garant, Protem 4, Provitec, Smart Temp Face. So there are basically many advantages in material which we will be reading in the next lecture. So these are the pictorial diagram figure which show photographs which shows about the big bis acrylic composite and the light cure resin. For both anterior and posterior teeth, they found the bis acrylic material significantly superior to polymethyl methacrylate in all category and amongst the various material. Studies have concluded that Protem 4 is the most color stable and with the superior mechanical properties. So in this lecture, we have read about the material for the short-term restoration temporary crowns and the long-term temporary crowns. And about the material, there were various material like acrylic, polymethyl methacrylate, polyar methacrylates, epimines, and composites. So among that, composite was one of the good material. For the recent advancement, we will be covering it into the next lecture. So thank you for today. Thank you, everyone.